and welcome. My name is Steve Halpern and I'm your health and nutrition news reporter. And I have some great news. Your body, every second of life, is making a very protective substance called glutathione. That's Glutathione. Glutathione is 3 amino acids put together in a very special way. It's made primarily in the liver, though other cells can make it, and the liver will export it to the rest of the system when necessary. Glutathione is one of the main protective substances in the body. It's the primary antioxidant. Research has been going on glutathione since the 1930s. A recent study I just read out of Australia, and they were recommending a new, promising, and they called it drug, and of course it's not a drug, for psychiatric problems and mental health problems. And that substance was glutathione. Well, we've known this again since the 1930s, that glutathione is rich in the brain and so protective. In fact, this study out of Australia talked about conditions such as anxiety and manic depression and normal depression and even ADD, so that instead of looking at mental issues as a purely drug issue, let's look at it as a nutrition issue. Let's look at it as the amount of antioxidants that are protecting the brain. So getting back again to glutathione. Glutathione is helpful in many health conditions. Studies have shown low levels of glutathione in osteoarthritis, in asthma, in psoriasis, in fatigue and chronic fatigue, in digestive disturbances. There's lots of glutathione in the stomach lining, and many people who have stomach distress have low levels of glutathione in the stomach lining. The intestinal tract needs glutathione to protect itself. So in issues such as colitis and irritable bowel syndrome, we often see low levels of glutathione. And in fact, it's been shown that there are defects in glutathione genes in prostate cancer patients and in breast cancer patients, and this defect is suspected of increasing the risk. So what can you do? If there's so many great benefits to glutathione, can you just take glutathione? The answer is yes. Tori Hagen and Dean Jones, very prominent scientists in glutathione research, have published studies that show you absorb glutathione not only orally, but through food. And why would you absorb pure pharmaceutical-grade glutathione any different than you would in food? And our experience over 12 years of talking herbals is glutathione works very well. The best way to take it is in a pure powdered form. You can swallow it, or you can get even better absorption just letting it dissolve in your mouth and getting direct absorption into the bloodstream. The mythology about the absorption of glutathione was based on a small study on 7 people done in 1993, and basically what they did is they gave a single dose of 3 grams of glutathione, measured the blood, 7 hours later it didn't change, and then they said you don't absorb it. Very poor study, very poorly designed, and created this mythology of that you don't utilize or absorb glutathione, and that's not been clinical experience. It's not very scientific. You want to use the purest glutathione you can. If you're under more stress, you take more glutathione. You take it with vitamin C. It's great to take with other antioxidants, and it's a great health tool to protect you from all the toxins and poisons in our environment. Real good studies on glutathione and influenza, and it was shown to inhibit the rhinovirus involved in the flu. So at the first sign of a cold, lots and lots of glutathione. I had the sniffles, which I almost never get, lots of glutathione and vitamin C, and it disappeared. So it works. So this is Steve Halpern, looking forward to bringing you more good health news. Stay healthy and well.